Very good morning to all. Today we are going to discuss about the topic custodial cardioplegia or HTK solution. Custodial cardioplegia, it is a myocardial protection system mostly we are using in the heart transplantation. Cardioplegia, it is a solution, it is giving arrest to the heart during a cardiopulmonary bypass. At the same time, it is giving a good myocardial protection to the myocardium of the heart. Cardioplegia meaning paralysis of the heart, as may be done electively in stopping the heart during cardiac surgery, may be done using chemicals or electrical stimulation. We can stop the heart function for a while by using the cardioplegia solution or by electrical methods. Now we are going through a small history of custodial cardioplegia. Cooling the patient to slow the rate of metabolism and chest was opened, operated and closed rapidly before rewarming. In 1955, Melrose and colleagues introduced the concept of elective reversible cardiac arrest, in which potassium citrate was added to blood at 37 degrees Celsius. The potassium citrate was associated with myocardial injury and heart necrosis, therefore abandoned. During 1960s in Germany, the Halscher suggested magnesium chloride with procaine amide for cardioprotection. In 1960s, the Brechnider solution in Göttingen, Germany developed a number of intracellular solutions employing sodium-calcium depletion. And in 1964, the Sønderberg in Denmark introduced Brechnider solution number 3 into clinical. In 1975, he reported 900 and AV operations with a low 6% mortality. Unfortunately, Brechnider and associate remained undirected for a long time. This is the huge history regarding how the cardioplegia became so usable, and regarding custodial cardioplegia, so much of information we are getting through this history. The custodial cardioplegia also knowing about Brechnider solution because it is developed by Brechnider in 1960s. It's a high flow, low potassium preservation solution used for organ transplantation, intended for perfusion and flushing of donor heart, lung, liver, kidney and pancreas prior to removal from the donor, for preserving these organs during hypothermic storage and transport to the patient. So, the main usage of a histidine tryptophan KETOGLUTARATE solution is organ transplantation for the myocardial protection. The main principle of HTK solution based on the principle is inactivation of organ function by withdrawal of extracellular sodium and calcium together with intensive buffering of the extracellular space by means of histidine hydrochloride so as to prolong the period during which the organs will tolerate interruption of oxygenated blood. Now we are going to see about the composition and the physical properties of HTK solution. It is similar to that of extracellular fluid. So HTK is an extracellular solution. 1000 ml custodial HTK solution contain sodium chloride, potassium chloride, magnesium chloride, histidine hydrochloride, histidine tryptophan, mannitol, calcium chloride, potassium hydrogen 2 ketoglutarates, and pH containing 7 to 7.20 at 25 degrees Celsius. The dosage and administration. The perfusion time for this HTK solution for the administration is 6 to 8 minutes. Perfusion technique, we are using hydrostatic perfusion and through perfusion pump also. The temperature of a solution is 5 to 8 degrees Celsius. Dosage 1 ml per minute per gram of estimated heart rate. As a perfusion pressure for adult, initially 100 to 110 millimeters of mercury. After cardiac arrest, 40 to 50 millimeters of mercury. For infants and young children, initially 80 to 90 millimeters of mercury, and after cardiac arrest 30 to 40 millimeters of mercury. Ischemic tolerance of the heart when using the heart-lung machine is 180 minutes. Main properties of HTK solution: it's containing low potassium concentration to minimize the risk during a myocardial stunning or over usage of a potassium, or it will lead to a hyperkalemia. So it is containing a low potassium concentration, a low sodium concentration for safe organ inactivation. Histidine buffers the acidosis caused by the accumulation of anaerobic metabolites during the long ischemic period. Tryptophan stabilizes the cell membrane. Ketoglutarate improves ATP production during reperfusion. Mannitol decreases cellular edema and acts as a free radical scavenger. HTK is perfused as a cold solution so that its hypothermic effect contributes to a decreased metabolic rate. All components of HTK solutions are naturally occurring physiological substances except for innate mannitol. Therefore, no toxic effects have ever been observed. Here, the bottles containing half liter, 1 liter, 2 liter and 5 liter. So, the custodial bag is also called Cryovac M312 is made of a new generation of advanced films for medical solutions. So, the material is based on exclusive multi-layer technology, resulting in a film that is exceptionally clear, extremely durable with a wide range of physical properties. So its storage is 8 to 10 degrees Celsius, shelf life 1 year. Advantages of a custodial solution: only solution used as a single shot, cardioplegia for prolonged ischemia, no surface cooling, no retrocardiac cooling, no obligatory reperfusion, high rate of spontaneous return to sinus rhythm, minimized cell necrosis, less depletion of ATP stores. Toxicological properties of HTK: disturbances of electrolyte balance, hyponatremia and hypokalemia, hypocalcemia. Plasma levels of the amino acids tryptophan and histidine may be elevated during the first 24 hours, induce acidosis during CPB time. HTK used in mainly long period operations or some complicated cardiac surgeries with long-term cross-clamping time. During examples of heart transplantation or ascending aortic aneurysms, dissections or non-cardiac applications. Complex congenital or congestive heart diseases, ASO, aortic aneurysms, hypertrophic obstructive cardiomyopathy, robotic cardiac surgery, minimally invasive myocardial or mitral valve surgeries, mitral valve defects, redo and complex CABGs. The comparison between HTK and crystallized cardioplegias in pediatric surgery: 118 infants 2 to 5 years old who underwent open heart surgery between January 2004 and December 2007. It is a result of an experiment or a research. So group H, they are showing with one single perfusion with HTK solution. Group S, they have a number of 55 with conventional St. Thomas cardioplegia. The result are, during reperfusion, spontaneous rebeating was higher in group H. No differences in inotropic agents and creatine kinase values on post-operative. Level of creatine kinase in group H is significantly less than that of group S on post-operative too. Mortality in group H was lower than in group S. Yes, if we give the blood good cardioplegia solutions with the good cardioplegic delivery management, hope the outcome of patient will be good too. Thank you.